I am Santisha Walker, your nurse advocate. I am a healthcare professional serving as a registered nurse and a certified wellness coach. Today, I want to talk about why you need your blood work completed annually and just general information about your blood work. But before we get started, it's really important that you have access to your lab results. And you can usually access this through the patient portal at your doctor's office, or you can call and request that information. Now, the reason why you want to get your blood work completed annually is because this is going to allow a snapshot of your overall health and what's considered within normal limits for your body, okay? Blood work shows the function of our organs, such as our heart, thyroid, kidneys, spleen, pancreas. It's going to show if there are any diseases that are related to those organs, okay? So getting your blood work done is extremely important because it can actually allow for early detection of diseases. It is because of these reasons it is important to have your blood work drawn. One of the lab tests that I strongly recommend that you get is called a CBC. This is a complete blood count, okay? Unless you have pre-existing conditions, you should get this done at least annually. If you have pre-existing conditions, high blood pressure, heart disease, diabetes, you should get this done probably every 3 to 6 months. But routine blood work, such as your CBC, and we'll talk about a CMP a little bit later, is really crucial to you staying healthy and maintaining really your overall health and wellness. And so when you get a CBC, this is going to detect any unusual increase or decrease in the cells in your body. And it specifically looks at the red blood cells, which carries oxygen to the cells that carry oxygen to the body, your white blood cells, the cells that help fight infection, your platelets, the cells that are responsible for clotting in your body. It's going to look at hemoglobin. It's going to look at hematocrit, okay? So it's important that you get that CBC at least annually. Another blood test, as I just previously mentioned, is a CMP, Comprehensive Metabolic Panel, okay? With your CMP, this is going to measure 14 different substances in your body or in your blood. It's going to be used to check the functions and the processes within your body. And so it also provides important information about your body's chemical balance or fluid balance and metabolism. And it also may help monitor or detect, but really monitor side effects from medications that you're taking. Some of the values that are measured with a CMP, that Comprehensive Metabolic Panel, is going to be your glucose, it's going to be sodium, calcium, potassium, which is huge, carbon dioxide, chloride. It's going to look at total protein. It's going to look at what we call BUN, and your creatinine, which helps determine the function of your kidneys. And so you want to make sure, again, you get a CBC and a CMP at least annually, unless you have those pre-existing conditions, which it should be every at least 3 to 6 months. So now that we've looked at blood work you should get done annually, now let's look at general questions you should consider asking your primary care provider. You want to ask them, how often do they plan to order your blood work? Again, should be annually, but depending on what's going on in your body, should it be every 3 months? Should it be every 6 months? Now you know to ask that question. Ask them, are there any concerns with the lab results that they have seen previously? Again, you should have access to those lab results as well. Ask them if they have not already, if they can order a CBC or a CMP. A CBC and a CMP is standard practice, you guys, okay? So that's something that should be ordered automatically, but just in case for some reason they don't order that, you now know to ask for that. Ask them if they think there are any additional labs that you should have done at this time based on previous lab results, based on any treatments that you've undergone, based on any new signs and symptoms that you've discussed with them. Ask them, when is the last time that you've had your A1C checked, your lipid panel, your thyroid panel, your hormone panel? Ask them for additional lab results that may be outside of that CBC or that CMP and what they think should be ordered in addition to those labs. Ask them if they can provide a PSA. These are for our men, right? The protein that's released by the prostate. And so they can measure the level of protein that's in the blood, but that's something that should definitely be done if you're a man that's older than 50, or if you're a man that's 45 and older and you have prostate cancer that runs in your family. For women, this is huge for us. Ask if they can order a bone density test, especially if we're 65 or older, okay? So remember, this is your way to advocate for yourself. These are your results, and so you want to make sure you're able to have a thorough conversation with them about your blood work, all right? And now you have a general working knowledge of the questions to ask them when you are in the doctor's office. If you have found this information helpful, be sure to subscribe to this channel. I have a lot more information coming, and make sure you share this video with others that you feel could benefit from this information. If you would like access to the Health Advocacy ebook and guide, be sure you go to santishawalker.com/books to access the ebook that is available to you on demand. And also you can access it at the link in the banner on the homepage of this YouTube channel. Remember, when you are advocating for yourself, it allows you to make well-informed decisions, and it increases your quality of life because you're able to have that dialogue and that conversation with your care team. I look forward to continuing to provide valuable information to you all. Remember to subscribe, remember to share, remember to comment below, and I look forward to continuing to provide advocacy information. Have a great one. Until next time.